If you've been struggling with bad breath, whether it's first thing in the morning or even after brushing or chronic bloating in your gut or unexplained gut issues, the problem might not be in your gut at all. It could be starting in your mouth. That's right. Most people don't realize that your mouth is the first step in digestion. And if your oral microbiome, also known as the ecosystem of bacteria in your mouth, is out of balance, it can lead to a cascade of trouble below the neck. What kind of trouble? Can be bacterial or fungal overgrowth in your gut, sometimes known as SIBO or SIFO. Also chronic inflammation, poor digestion, even heart disease. So if you've noticed bleeding gums, cavities, loose teeth, or a coated tongue, it's time to pay attention because your mouth is giving you a cry for help. Today, I'm sharing tips that transformed my oral microbiome and helped me ditch morning breath for good. There is often an overlooked connection between oral health and gut health. Wait, what's the oral microbiome again? It's the community of bacteria living in your mouth. When it's balanced, then you thrive. And when it's imbalanced, everything from bad breath to gut dysfunction to even cardiovascular issues can follow. Red flags, your microbiome might be out of whack. You might have a white or coated tongue. You may have morning breath. No, that's not normal, believe it or not. You can also have bleeding gums, frequent cavities, wiggly teeth with no apparent reason. If you also deal with gut issues like chronic bloating, SIBO or SIFO, your mouth might just be the missing piece. Here's 5 steps to reset your oral microbiome and heal your gut in the process. Step 1, use a tongue scraper. It looks like this twice a day. Or if you don't want to buy a tongue scraper, you can use a stainless steel spoon like this. So true story, my daughter used to refuse to use the spoon, but once I got her the tongue scraper, then she uses it faithfully. So you choose what works best for you. The tongue scrapers, they're all over Amazon. They're not very expensive. Also floss twice a day. You can use really any kind of floss. The one I think is like the best one that I've found is this. It's a Smart Floss by Dr. Tongue's Smart Floss, and it's free from all the BPAs, phthalates, and fluoride. I've used also Glide in the past, which is a really popular one. It does have some of these microplastics and things like that that can get into your mouth, but at least you're flossing your teeth if you don't want to opt for this more expensive Dr. Tongue's floss, which I think is probably the best one available out there right now. Then after you do that, use a water pick. I have one for my house. I brought it out so I could show it to you. Just any one on Amazon. It comes with different heads. So this one, I have this head on it right now, but you can see these usually, not just the one that I got, come with different heads that you can use like this. Here's like a tongue scraper head that you can use for your mouth. And they also make them as travel varieties that look like this. And this one also comes with different head options for you to play with and see which one you like the best. You want to use that after you floss. You'll be amazed at what still comes out even after flossing. A water pick really helps to clean your mouth without nuking the oral microbiome. So that is an excellent tool that I feel is often overlooked. And then step 4 is, of course, brush your teeth twice a day. You want to use the right tools. You want to use a soft bristled natural toothbrush, ideally something like this one, which is a bamboo. You can find these on Amazon. They're all over the place. You definitely want it to be a soft bristle, even if you don't use a natural toothbrush like bamboo. But if you can opt for the bamboo, then that's even better. We're getting filled with all these microplastics, so we want to minimize how much microplastic is going into our mouth. And then choose a toothpaste. I like the ones that have silver, which naturally kills harmful bacteria, hydroxyapatite, which naturally remineralizes and strengthens enamel, also probiotics. So yes, your mouth needs them too, and they help replenish a healthy oral microbiome. The one that I've been liking recently, it's from Designs for Health. It's the Periobiotic Silver Designs for Health. I'll link that in the description below. Then, of course, step 5 is see your dentist, preferably a biological dentist if you have access to one, or your hygienist twice a year, so they can give you a nice deep clean and help spot any issues that are going on. And then bonus tips for healthy oral gut connection are things like making sure you're eating a mineral rich diet. So think about calcium, vitamin D, K2, and phosphorus to keep your teeth strong. Xylitol is also great for killing bad bugs without harming the good ones. Some people will chew the xylitol gum. You want to go easy on that though, because xylitol is not always healthy in larger doses, but I think a little bit of it's not a bad idea. You can also do oil pulling with coconut oil, or some people use castor oil. I love Dr. Sanda Moldovan's Orasana kit. This was created by one of the top Beverly Hills biological periodontists that I personally interviewed. Her kit is an all-inclusive kit. It has a natural toothbrush. It comes with a travel size water pick and probiotic mineral tooth powder, as well as oral probiotic mints, sleek travel case. And like I mentioned, I've recently started using this Designs for Health toothpaste. I will link it in the description below. And I like it because it has the silver, which naturally kills pathogenic bacteria. It has hydroxyapatite to strengthen enamel, probiotics to restore your oral microbiome, has no fluoride, no junk, just great results. Now let's talk about what you should avoid for a healthy oral microbiome. Sugar, number 1. It feeds bad bacteria and wears down enamel, so check for hidden names like glucose, fructose, sucrose, dextrose. Anything that ends with an OSC is almost always some sort of sugar. And other names like corn syrup, agave nectar, maltose, molasses. Also, most mouthwashes kill all bacteria, which you do not want. So including the good kind that makes nitric oxide, which is very important for healthy blood pressure. So if you're killing all of your good bacteria, this frequently leads to high blood pressure, according to Dr. Nathan Bryan, who I also interviewed a while back. Also, fluoride, you want to definitely steer clear of that. It's a known neurotoxin, so no thanks on that one. And acidic drinks on your teeth. Lemon water or apple cider vinegar, they're fine if you use a straw and you rinse your mouth afterward. I drink lemon water every day, and I haven't had cavities or any issues with my teeth in probably over 20 years, but I always use a straw to help keep my teeth away from the lemon. So if you're ready to upgrade your mouth to gut connection, check the video description for links to my favorite oral care tools and gut supporting supplements with discounts. And if you want to learn more from Beverly Hills periodontist Dr. Sanda, you can go to the website on the page below, or you can click the link in the description and sign up to receive an exclusive access to the interview I did with her plus 9 other health experts. So if you just click that link below or visit the site on your screen, you will get access to that. If you found this helpful, don't forget to check out my next video here.